Nearly one-third of LGBTQ New Yorkers are over the age of 50. This is the Stonewall generation. They are the trailblazers whose resilience and dynamic leadership sparked the LGBTQ movement and the fight for social justice. Yet they remain largely invisible, and many of the disparities they face are still rooted in the same discrimination that started the movement decades ago.
The numbers are disturbing. 23% of LGBTQ New Yorkers of all ages cite inadequate insurance coverage as the most significant barrier to health care. And 1/3 of LGBTQ 50 plus live at or below 200% of the federal poverty level. Because many LGBTQ 50 plus people live alone, 21% have provided caregiving to their friends, and that is 3.5 times what their non-LGBTQ peers provide. And 8 out of every 10 LGBTQ 50 plus would feel much more comfortable with healthcare professionals who were trained in LGBTQ patient needs, training that is now lacking in our current healthcare system. It's time for change.
However, disparities pose challenges as LGBTQ New Yorkers seek inclusive healthcare, economic security, and housing. Social isolation is especially prevalent since LGBTQ people are far more likely to live alone and less likely to have familial support systems. The pandemic has created even more isolation and inequity.
The inequities that LGBTQ New Yorkers face in health and livable communities and economic security and social connection and caregiving stem from a lifetime of discrimination. We must and we can come together to build and provide equitable solutions that improve the lives of older LGBTQ people.
It's imperative, especially during the current pandemic, that LGBTQ New Yorkers do not get left behind. They need to have the same access to vaccines and basic needs as everyone else. Healthcare, especially now, should be inclusive and accessible. New York's leading organizations that advocate for the LGBTQ community are working together to outline the situation and propose clear solutions. Our latest chapter in the Disrupting Disparities series shines a light on the harsh reality of these disparities facing LGBTQ people of all ages, especially people of color, but it also offers real solutions.
LGBT older people are extraordinarily resilient, and at the same time, they face tremendous disparities and challenges. That's why SAGE is so proud to be partnering with AARP, the country's leading champion for older Americans, to decisively address the needs of LGBT older people with this groundbreaking report.
By analyzing social, health, and economic issues from a culturally aware perspective, legislators can find effective answers for a population that's been discriminated against for far too long.
You know, the COVID-19 pandemic has laid bare the unconscionable health and financial disparities that are made more difficult by the racial identity, sexual orientation, and gender identity of older New Yorkers. That's why I'm proud that AARP New York, the AARP Foundation, and SAGE have joined forces to develop the Blueprint for Action. Local, state, and federal leaders from New York have the potential to offer the nation examples to narrow some of the most persistent LGBTQ health and wealth disparities in these challenging times.